All right, thank you. My name is Marissa Mawazin. I work with KCDC, as we call it, Knoxville's Community Development Corporation, in our strategic partnerships and policy. And
I'm a social worker with the Community Action Committee in Knoxville, Knox County, Tennessee. And at my heart, I am truly a social worker who believes in community action. We are one of 20 in the state of Tennessee and part of a national partnership network of over 1,000 community action committees.
And if you're not familiar with KCDC, we are the housing authority for Knoxville and Knox County. So combined, our two agencies have over 140 years of experience of working within the low-income community and with low-income residents. So our vision is to transform the delivery of existing government services in a way that meet people where they are, walks through them, through their needs with them, and then provides the directed resources to help elevate individuals. Our proposal is unique in the fact that we're not creating a new system that in the long run could be unsustainable. We propose that changing how those systems, current systems, intersect with low-income populations is the true way to end generational poverty. We're proposing a paradigm shift based on what we have heard from our residents and our partner stakeholders. Over the past year, we've spent time conducting a needs assessment in all KCDC properties and finding out what low-income individuals want, need, and is missing. And so we've used that to inform, as well as all of the data we collected during the preliminary phase. Understanding where people are now, meeting them there, and walking with them, and not creating another system for them to navigate, and introducing unfamiliar people to engage with is key for our success. We are strengthening the community that already exists, which is what we heard loud and clear through the planning process. Systems are currently designed to disrupt and force others to migrate to where the agency wants to create community. It makes individuals leave the community where they have comfort and go to where the agency, typically in multiple different locations, wants to serve them. The community exists. There is community now. And if we want to help and to truly help, the resources should come to Ben and build up from where individuals are at. Our pilot is focused on moving the needle of generational poverty and documenting how other cities can replicate it using agencies that are already in place, thus sustainable. There's 4 things, and some of them are highlighted on this slide, that we really think are those pivotal pieces. There are invisible barriers and walls that exist to accessing public services. If you think through our needs assessment, we learned 37.4% of low-income residents in public housing don't have internet access. And another 18.6% only have access on a cell phone. So we can't put internet surveys out there. Our surveys we did, we mailed one and went to every household. We had over 30% response rate, but in something we'll talk about with our resident ambassador program, those properties had over an 80% response rate in survey response. 50% of families living in public housing do not have cars. So if you have to use the bus to access services, to take a child to daycare, to get to education, to get to a job, and then to get to supportive services, by the time you have transit times, your time is gone. There's not enough hours in the day for you to be able to accomplish that and work an 8-hour job. It's not possible. Number 2, the perception that change isn't possible, whether it's real or perceived. The ideas that change cannot happen are barriers to progress. We have generations living in public housing. We have sites that 3 and 4 generations live in housing. They don't know what change is. They haven't seen someone model the behavior that we want folks to be. You don't seek out services if you're not confident of the change. So we need to bring the resources to them. They are not going to seek them out if they don't know they exist. And that's where we use community navigators and resident ambassadors. Third, the fear of the benefits gap. I know you've all heard about it, and it's real and relevant over the past 2 days. This department with TANF already has programs in place with transitional cash assistance and diversion payments, but other agencies haven't caught up. And so our proposal suggests benefits gap assistant where those other agencies have fallen. And fourth, acknowledging and addressing contributing factors. Part of our proposal brings services to the site to acknowledge the fact that you can't walk into a community and assume the only barrier is workforce development. There are other contributing factors. There are mental health issues. There are substance abuse issues. There are food needs. If you are hungry and you don't have fresh food, you're not going to go to work. There are barriers we have to get over, and physical health as well. Go ahead. So we're proposing a Foresight model, and we're doing this because we want to create replicability. We have 4 unique sites that we've chosen that are public housing sites within Knoxville. And they are First Creek at Austin, Northridge Crossing, Montgomery Village, and Western Heights. You can see the statistics here. The average annual income is between $8,000 and $15,000. Residents, over 40%, almost 50% are children on those sites. The majority are single-parent female households. And then the breakdown, very few of our elderly residents are at those sites. We have dedicated elderly and disabled properties as well. These are 4 unique sites, and although they are all in the same city, they all have unique pieces about them. Northridge Crossing is completely surrounded by interstate, and you cannot walk to any services. There is nothing nearby. Montgomery Village is south of the water, surrounded by industrial and unique and in a pocket of itself. Western Heights is one that we've been focusing on. It's in the middle. It's well connected, but it's been a forgotten neighborhood for 100 years. And there is a lack of services there. Oh, go ahead. So what we're proposing are bringing together service providers to the site and locating them on site. And we are partnering with CAC and their Head Start program, locating Head Start programs on public housing sites so that parents can feel safe and secure and trust the provider and get their kids to school without that transportation barrier. We have Boys and Girls Clubs on or near the 4 sites we're proposing that we partner with. So we have youth development services available. Workforce development, partnering with our colleagues at the University of Tennessee Agriculture Extension, who has Department of Labor grants that they have for a program called Skills Up that provides educational equipment, services, tools, uniforms, anything someone needs for job and workforce development or the training to go to school, mechanic or plumbing, free of charge if you're on SNAP. So we're able to partner and really benefit from the other programs that are out there. Health and wellness, having 2 nurse navigators that are on site, not to provide clinical services, but to navigate the healthcare system. Being poor is hard. And it is hard work to be poor and figure out all the systems and where you need to go and how you access services. In addition, behavioral health services on site. We can't do this without mental health support. You cannot take someone who hasn't been working for years and has fear of the system, fear of the benefits gap, and suddenly put them into a program and think they're going to thrive. There has to be built-in mental health support. And then mobile fresh food access. We have a partner that's going to bring mobile fresh food onto each site on a weekly basis. So now we're addressing the nutritional elements to really help individuals' physical and mental health, so that will then allow them to even be able to start workforce development.
Throughout the Parenting to Prosper proposal, we align with TANF and the Tennessee Department of Human Services outcomes. In essence, we are creating a scalable collective impact in areas of concentrated generational poverty that focuses on sustainable family financial stability, that builds on the leadership capacity within those communities, and engages the whole family through 2-gen family-focused case management. I've got the clicker. Throughout the planning process, we've garnered key partners to drive the Parenting to Prosper efforts. These backbone partners will continue to build on and enhance native neighborhood resources that will, again, build on that leadership capacity that's already in those neighborhoods to create a long-term community that is benefiting those neighbors and residents that live there. CAC provides the 2-gen case management model. As Marissa mentioned, UT does the Skills Up, the employment piece. The Dream Center will bring in the mobile meals or the mobile food pantry. And the university brings in multiple components of those nursing navigators, early intervention specialists to create an early childhood education cooperative for those families that may not want to access Head Start, may not be eligible for Head Start, and that will be for those that may give in-home care or provide care to family. Also, the psychiatric unit of the University of Tennessee would provide on-site behavioral health, and we have another group within the University of Tennessee providing collaborative communication. And what that truly is listening to the residents and the neighbors and the partners that already are living in those communities and helping them understand the network of services that are there and provide input into future programming and to create a strategic plan for their communities and future sustainability. Helping Mamas would also, help with mentoring for those that are working towards their goals and provide positive enforcement or positive encouragement to those families. And the Boys and Girls Club would provide the youth development. So at CAC, we've been providing 2-gen services through our Resilient Families program for several years. And we provide this family case management model, and we were recently recognized as one of 5 Aspen grantee recipients nationally because we have student parent advisors, students who have gone, or participants who've gone through our program, enrolled in educational activities that are now mentoring and supporting other newer participants within the program. Our approach is intentional, it's strengths-based, family-centered for the whole family, both the parent and the child. We dig in and get to know our clients and what their needs are. Parents engage from the beginning and choose goals that meet their contextual situations, give insight and voice to our program development. They literally will say, we need a support group or a play group for moms, or we need to have just a night out, just to chill and hang out with our kids. We build peer-to-peer relationships. I know as a mother, one of the things that I missed in early motherhood was being around other mothers, other people that understood my situation. And we want to help them learn how to enhance their parenting and learn, nurture their children in more intensive ways, to move from the tyranny of the moment to from surviving to thriving, and ending that cycle of trauma towards a healing and long-term physical, mental, financial, and family health.
So our budget, the way the budget form is, this can be a little misleading in the fact that you see a chunk here with specific assistance to individuals. Over $6 million, and actually over half of our grant is direct assistance to individuals. It just happens to pass through our partner agencies to get to the individuals. So direct services and then direct supports through that case management is going to the families that are involved. Why the sustainability piece? Programs exist. These nonprofits exist now. They provide the services. What the disconnect is how individuals are getting to those services, and then the wraparound pieces, that case management support, and bringing in all of the supports to bear on individuals where they are, where they're comfortable in those communities. Well, our community plan shows over 1,300 households that live within those communities. As individuals move out, as they're able to gain self-sufficiency, that's a new family that moves in. So what we're talking in is 1,300 doors. And ideally, families will move through those doors on a pathway to self-sufficiency, and new families can enter that pipeline. CAC brings neighborhood centers. So not only located on these sites, there's also neighborhood centers in Knoxville that families who have moved on through self-sufficiency will always have as a point of contact to be able to come back and access services again. So our opportunity pilot is allowing us to try a new and innovative approach. This funding would allow us to try a model that hasn't been done. It's been done in transitional housing. It's been done in permanent supportive housing when we're looking at substance abuse and mental health. but it hasn't been done in family self-sufficiency. And we know it works in those other two areas, so why are we not trying this? And we know that if successful, if we're able to produce results, agency funding is going to follow. Because agencies want their grantees and their nonprofits and nonprofit agencies want to be successful. We want to help people. So if we're able to show through success, which we know we can through this funding, we're hoping that it would be something that will replicate across the nation.
Can you tell me what will be different in Knoxville when this goes into effect than what currently exists?
Currently, for a family to access services, they have to know the services are there. They have to then seek out those services on their own, often with the transportation barrier. What we're proposing to do is reduce that invisible wall. Take the invisible wall and the assumption that because a service exists, everybody's going to come to it. Put it on site, work with families where they're at. We're adding resident ambassadors. So we've added that to one site recently in the past year as a trial run to see, and we've seen huge response. Families are coming out, they're engaging with each other. They see peers who are starting to be successful. And having that model has been tremendous. Our needs assessment, we have a 30.1% response rate across all properties. The property where we have resident ambassadors, where we're starting to put some of this in where we're able to on a limited scale, is 80% response rate. And those families are coming out. We're doing community resource fairs on site. We've brought community partners to talk with agencies and talk with residents. They're coming out to them, but then it ends. We want to build that connection.
I'll add to that. You know, I've really been working in one particular community of the 4 communities, and it has been life-changing for me as a social worker. I have been involved in many different arenas of social work, but this has been true community action. And what I've seen at first, you know, knocking on doors, people wouldn't answer because why are you knocking on my door? We don't have strangers knock on our door. To, hey, Lisa, you know, or hey, Tracy. And when we have our community events, you know, we had an event in the fall and we gave out a full Thanksgiving meal, and we had other providers there talking about their services. And usually what you see at one of those fairs is people will take the items and they'll hit the door. What I saw there was they took the items back to their apartments and then they came back and hung out because we created a community. Just 2 days ago at the Easter egg hunt, I got to see some people I hadn't seen in a while because it's winter. I was like, hey, oh my gosh, it's so good to see you. And we got to see their children again. It's just, it truly is building a sense of building on community that's there, but building it and enhancing it further is pretty amazing to watch. These are islands.
Tell me how you define success in this initiative.
We have built-in tracking through case management. So looking at one, we've said access to resource, simply the inquiry about a resource will be a touch point, will be a success point that we look at. And then how we move folks through that, how they engage, what resources are they accessing. Not everyone is going to go down the same path. So we're going to watch which ones they're interested in, what they're doing, how we can bring all of what they need to them. We're not limited to these partners either. If families come, we have 95 partners across what we've brought together to work with low-income families. If there's a family that needs a resource, we're going to bring it in. So success is going to be tracking that and ideally watching families at the ultimate goal, families to move on to self-sufficiency and out of public housing.
And I'll add to that. You know, within CAC, you know, there is benefit to being part of a national affiliation, and we do the results to outcomes measurement and accountability, the ROMA model. And what we do with all of our case management, regardless of 2Gen, is we're looking at, are they moving from surviving to thriving along our scale? We're also, you know, sitting down and reviewing our logic model, our family goals with those individuals as we work with them. And we'll be looking at, okay, are you just simply, you know, maintaining what you've got, or by how much are you gaining? And then what, you know, benefits are we gradually able to transition you out of? And the other thing with our resilient families we've seen is they meet some of their, you know, goals, but we're able to keep them with that program for as long as they really need us. So it's really just the continued engagement and how they're, you know, moving across with percentages of income increasing and decreasing their benefits, you know.
So much, doing a great job. Tell me, we had the pie charts up, the budget, and I'm always the one who asks about budgets. Tell me a little bit about the investment that you foresee in this plan. Tell me where we're investing in the recipients and how we're getting them off of public assistance. So tell me the investments there, please.
Yeah. So a large chunk of the investment is the benefits gap filler, is providing. We have an average number in the proposal, but the sliding scale of what the individual needs to be able to, to take away the fear. Right now, the fear is I'm going to lose all my benefits, so I can't earn anything. So what if we can make that guarantee using the money in the proposal to say, okay, if your income, if you get a $9 an hour job, your rent's going from $0 to $426 a month. So we're going to use this funding to help with that as you transition into the workforce, so you don't have these huge budget cliffs immediately that then suddenly you never enter that workforce. That's a lot of the funding. The remaining of the funding is going to being able to support Head Start on site, being able to support the Boys and Girls Club located physically at 4 of the sites. It's the case management piece as well. Case management's expensive to do it well. So the case management piece, providing those direct services to clients, is probably the largest chunk that's up there.
Tell me a little bit about that Head Start piece as well. Is that something where federal partners are working with you on, and
Yep.
Knoxville Board of Education? And tell me a little more about that. And is there capacity to have, I think you mentioned in the 4 zip codes, a facility, a location to house those Head Start programs? Tell me a little bit about that, please.
So I'll start with the budget piece, and I'll give it to Lisa. From the budget piece, the operating of Head Start is covered. What we're asking for is the lease payments in the proposal. So our federal partners will continue to fund Head Start. And so that is wonderful. That is not something that we need to include here. We have one site currently at one of them. We are opening another site in 2 months. And then we are planning to get the other ones going during this time frame. So again, using federal partner support for the operations, we're simply looking at the occupancy piece to actually make it happen.
And I will say, Head Start is actually part of the Community Action Committee in Knoxville, Knox County, and not, you know, through the school system. Yeah.
So it's through.
Yeah. So we're, you know, providing the case management piece, the 2Gen piece on site, and neighborhood resource coordinators and resident ambassadors, you know, peer-to-peer networking. And then also that Head Start piece is where CAC comes in.